H. pylori or Helicobacter pylori. It's a bacteria that causes a chronic infection of the stomach. Now, this is the thing. Most people infected with H. pylori don't have any problems, but there can be major problems. Stomach inflammation, inflammation of the small intestine, ulcers, and rarely stomach tumors. This is a really big deal. First of all, I want you to write in the comments if you are familiar with H. pylori. Also, write where you are watching from. This is a video I've been wanting to make for a long time, so I'm really, really happy that you're here. So H. pylori, again, a bacteria, causes changes to the stomach and the duodenum, which is the first part of the small intestine, okay? And what happens is this bacteria can infect the protective tissue that lines our stomach, which causes lots of problems, enzymes, immune system activation, all sorts of stuff, okay? The problem with all of this, though, is that it ultimately damages the cells of the stomach or the duodenum, and this causes the inflammation I was talking about. So inflammation of the walls of the stomach or the duodenum, which is the first part of the small intestine, all right? Now, I'm going to talk a little bit, don't worry, I didn't tell you what I was going to talk about, but let me tell you what I'm going to talk about, which is how it is spread. We're going to talk about that next, but also how it's diagnosed and how it's treated, but also we're going to talk more about symptoms, okay? So in terms of how it's spread, there is debate about this. My source today is Up to Date, which is a medical source that a lot of us docs and healthcare providers use. According to Up to Date, H. pylori is, and I quote, probably spread by consuming food or water contaminated with the organism that is excreted in fecal matter of infected individuals. That's a complicated way to say like fecal oral. There's questions of oral to oral transmission, but that is something that has been discussed and debated. All right, now this is the thing. H. pylori happens all throughout the world. Now, in the United States and in developing countries, we see H. pylori more commonly in adulthood, less commonly in childhood, but in many countries, more children are infected by H. pylori, so keep that in mind, all right? Now, symptoms, let's talk about this. If you simply have like the inflammation of the stomach and the small intestine that I mentioned that H. pylori can cause, I'd say most people with that inflammation don't have symptoms at all. Like you may not even know you have H. pylori. Most of my patients who've been diagnosed with H. pylori didn't even know they had it, and neither did I, okay? However, people who go on to develop some of the more serious problems that I mentioned, whether it's like stomach or duodenal ulcers, rarely tumors of the stomach, you can get symptoms. So let's just talk a little bit about ulcers, right? So if you get ulcers of your stomach or your duodenum, there's a number of symptoms that can happen. Of course, you don't have to get symptoms, but ulcer symptoms tend to be things like pain or discomfort, usually in the upper abdomen, okay? Patients may feel bloated. You may feel full after eating just a small amount of food. You feel satiated early, like you eating a little bit makes you full. Your appetite might be lower, nausea or vomiting. You might even have dark or tarry colored stools. If you have a bleeding ulcer, that certainly can cause problems with your blood counts and also fatigue and things like that, okay? So remember, that is if your H. pylori is leading to ulcers that you get those symptoms. But remember, most people probably just get the inflammation of the stomach or duodenum, and people mostly with that don't necessarily have symptoms. I also just want to sort of remind us it can cause cancer. This is why it's really, really important. So you're probably saying, well, how, since I may not know I have it, you're like, well, how would I know if I need to get checked for it? Now, this is actually something that's a bit more complicated. And I'm going to leave this up to the gastroenterologist because your risk factors, who you are, any symptoms you have, all that kind of stuff is going to play a role, okay? But let me reassure you that there is and there are good testing capabilities. We have stool tests, we have breath tests, and we have blood tests. And also, let me tell you this, that we also have medications, which is awesome, okay? It's really, really important to keep in mind that we do have medication. So what I want you to do, again, if you haven't written below, if you have H. pylori or you've had it, if you've been treated for it, if you had ulcers even or anything like that, write in the comments. I would love to hear your story. I think this is a really important topic to talk about because so many people throughout the world are affected by this. Guys, I'm Dr. Jen. Subscribe to my channel. Follow me on Facebook. I'm on TikTok, Instagram, LinkedIn, you name it. Also, please go to my website, drjencaudle.com, to sign up for my free health newsletter. Bye.